Hello, welcome to the Living Her Legacy podcast, where we celebrate and serve mamas who are living their best life after starting their family. I'm your host, Jill Sutton. Thank you for joining today. In today's episode, we talk to Dr. Allie Day, owner and founder of Better Day Chiropractic. We talk all things chiropractic care in regards to pregnancy and postpartum. We get into lactation and mental health. That's coming up on this episode of the Living Her Legacy podcast. It's so funny because when I decided to kind of do this, like you literally are the first person that came to my mind. It's so crazy. And I think it's because we serve the same population. Like we have the same heart for those people. And I think like pregnancy changed me, and becoming a mom, obviously, I think it changes everybody, but like, I just was like, oh my gosh, like there's such a need there. And I love, like, that is your mission basically.
Mm-hmm.
So I'm just really happy that you're on.
I know I finally got through, like, all right, speaking like this makes me nervous too. So I'm like, okay, I
Right.
know she wants it, but okay, I'll check the calendar link and see what she has next week. Okay.
Yeah.
So
And
I
that's
know
the
it
thing is
took me a
like,
little while.
just I think for most people, it's like the first podcast they've ever been on. So it's kind of
Mhm.
like, but it's the first time I'm doing it too. So I feel like it's really not a big deal.
Yeah.
But again, like our population. So like my goal is to reach moms and all walks of life really, but just that are trying to make the best life for themselves. And even in reading your answers on the type form, I was like, oh my gosh, like we're just like so like it's the same, like what life looks like for you is what your best life is and how you need to pursue that. So I just thought that was cool. So I'm
I
excited.
love that. Good.
Okay, so welcome to the podcast, Allie.
Thank you. I love being here. Thank you.
I want to just do a quick intro. So if you want to just say who you are, maybe where you're from and what you do.
Yeah. So I'm Allison Day. I'm a specialized pediatric prenatal chiropractor by trade. I'm a mom of a little 2.5-year-old son, Thomas. And I'm from Westchester, Pennsylvania. So originally California, half my life, Pennsylvania, half my life, but I claim Pennsylvania as home. And I moved down here to the South. Yeah.
Okay, so I love kind of your story on how you, not maybe how you became a chiropractor, but like in the last couple of years, you have opened your own clinic and it wasn't easy. So I
No.
kind of want to hear maybe the backstory on that, like the timing of that in your life and really like how that came to fruition.
Absolutely. So I am a chiropractor for 5.5 years, and I started with a clinic in South Charlotte, seeing generally the older population. So our average age was 60, 65, and it was nice, but it wasn't the population that really brought me to life. And I ended up getting pregnant in 2019 and had my son in June of 2020. Now, the goal after I graduated was always to open my own clinic. And I was with a doctor who was priming me for that, and it kind of lost its way. And 3 years, I'm still working at that office. So when I was pregnant, I thought, okay, this would be the perfect timing to make this switch. Of course, 2020 happened, and I'm still pregnant in March of 2020, and things are starting to slow down. People are getting sick. And so I didn't feel comfortable staying in the office that I was at. So I went on an early maternity leave. During that time, I really thought, wow, there's not that many providers in our area that are specialized in pregnancy and pediatric care. And I didn't find very many resources that were available to the public. So, of course, providers, we understand who they are or where they're located, but as an average mom or family or parent, the resources weren't so obvious. And so I thought, well, I'd like to be the obvious option for these moms. And I had already gone through the certification process to be specialized in pediatric prenatal care, and I wasn't utilizing that specialty in the office that I was currently at. We would see maybe one or two pregnant women and then their kids, but it wasn't really focused on that. And I just really wanted to dive into it. So I thought, well, all right, it's time. I'm going to open my own office. And of course, that was scary, especially during 2020 when people weren't going outside and seeing people. And what does that look like to open up your own office? So I opened up 3 months postpartum. I'm calling banks and talking about opening up accounts while holding my son in the office and, trying to get him to quiet down so I can even have these conversations to fill out the state paperwork and things like that. But it really is something that I enjoy doing now that I have my own clinic and able to focus on the population that really, I think, was underserved in our community.
Definitely. Oh my gosh, you answered like 6 of my questions just in that. So, um, one of the things that maybe I wanted to like touch on again that you mentioned is it is difficult for maybe the average person to find the care that they need or to even know it's available. Let's just say there's a mom that is pregnant or expecting. What do they need to look for? Like you said, you have a certification. Is that something they need to look for when they're looking for a provider in their area?
I absolutely believe that it is something. So in school, we are taught one class that is special populations, and so that includes, people that have difficulty walking, such as paraplegics, quadriplegics, um, pregnant women, different sicknesses. So it's a topic in a course. And I don't think that every chiropractor is comfortable. Now, that may be that they're knowledgeable, but they're not comfortable seeing that population. And there's other things that are important to get addressed. So at the clinic that I was seeing or working out of, the other doctor would adjust me. And I even sought out an additional chiropractor to see during my pregnancy. I couldn't take care of
Mm.
myself, and I didn't think that I was getting the level of care that was necessary during pregnancy. And so, a Webster certified chiropractor is the chiropractor that is specialized in seeing pregnant women, and also most likely those that would be more focused for pediatric care. So there's an organization called ICPA. And if anybody in the nation, really around the world, wants to look for somebody that is specialized in pediatric, prenatal, perinatal care, so around pregnancy, so it includes postpartum. If they went to ICPA, the number 4 kids.org, they can find a certified chiropractor or somebody that specializes in that in their area, which I often send any of my friends or family that don't live in Charlotte, North Carolina. This is where I send them. And then, of course, you look on their website and just look to see, is their content more focused towards pediatric prenatal care? Then they're probably somebody that's seeing more of that population. And I really do think it's important to find somebody that specializes in that. Outside of chiropractic care, right? I do believe that PTs, those that specialize in pelvic floor, women's health PTs, super important. Most people don't even know that that's something, right? I'm sure you get that
Mm-hmm.
all the time.
Mm-hmm.
Having different resources such as like a doula or midwife, mental health counseling for even grief, or postpartum or prenatal mental health is huge. I mean, before the pandemic, it was 1 in 7 women had postpartum depression or anxiety. I can't imagine what it is now. I know they're still doing studies on that now. I was in one of those studies when I was pregnant and postpartum. But if 1 in 7 women had postpartum anxiety or depression before the pandemic or before the shutdown, before isolation, can't imagine what it is now. And so I
Oh
was
my
so
goodness.
thankful that yeah, absolutely. I was thankful that there are community groups in Charlotte. Now, if you're Charlotte local, there's Mind Body Baby NC, which is a wonderful organization that compiles all of those resources. So different providers that specialize in anything postpartum, perinatal, pediatric. They can find a provider that way. But it's important to get into community groups, whether that be virtual or in person, to help with the transition from pre-motherhood to motherhood, because I think it's huge.
Oh my goodness. It really is. I mean, I think it's hard to even describe to somebody beforehand, like the changes they're going to go through. I mean, there's like certain things that are the obvious that you might like mention to be mom, but like, I think again, it's each individual's own experience and the levels that they feel, maybe the anxiety they feel or the depression or whatever. For me, I definitely know like I had some of that anxiety like through the roof, and it especially like would come on at like bedtime because I knew I had been already up all day with a kid and I knew I was going to be up all night, and it was kind of
Mhm.
coming into those hard hours. So I definitely love that it is definitely being addressed now and more open, and there are more support groups for that. So that's amazing. Thank you for touching on that. I'm going to also link all these things in the show notes so that people can like click for resources, because again, I think it's just getting the word out there that there are resources for them. So that's great.
Absolutely.
I did want to ask you too. So, like, a lot of times we don't seek out maybe like professional help until there's a problem. Can you go through maybe the benefits of care before there's an issue? Maybe while you're pregnant or postpartum, let's maybe touch on those two before there's an issue, and then maybe run through a few, symptoms that people might have that you can help with.
Yeah, absolutely. So, as a chiropractor, what I focus on is the nervous system. So, a lot of people think that you have to have back pain or neck pain or headaches in order to see a chiropractor, and that's just not the case. Because we're making sure that the brain can communicate to the rest of the body. So, that's every organ system, every cell, tissue, every function in the body. The brain has to be able to communicate effectively to that system and then receive messages back up so that it can tell the body what to do. And so, as a chiropractor, what I'm doing is I'm making sure that those wires are connected again so that your body can function optimally and at its best. So, I love thinking about the Claritin commercial. If you think about it, there's like a foggy day, it's gloomy, it's gray, the person's walking through, they don't see the definition on the trees or the leaves or the flowers, and then they take Claritin and everything's beautiful and bright and they can see the birds and the bumblebees and everything. And I think that's what chiropractic really does, is it helps amplify the expression of life. And so you don't have to have pain in order to come into a chiropractor, regardless of pregnancy or infants. I think it stems from birth. I see newborns. My youngest patient was an hour old. You don't think that they have pain, but there's dysfunction in their body that could be improved or corrected with chiropractic care. Now, as far as symptoms go, for someone that's pregnant, sciatica, indigestion or heartburn, back pain, hip pain, especially during sleep, issues with sleeping. It can also help with mood, so energy, decreasing your stress, the effect of stress, or helping managing anxiety. So that is one thing that a lot of my pregnant women are coming in with, huge with hips and sciatica, but also creating great function as far as your pelvic or your pelvis, and making sure that it is in the proper position so that baby can get into a proper position. We don't ever change baby's positioning, but we allow for an optimal environment for baby to get into a good position. So some moms that are worried about positioning with their baby, making sure that they have a good posture and setup is important, and biomechanics is important. So we're focusing on that with a mom. Not only that, but during birth or during labor, making sure that the baby can get out of the birth canal without bumps along the way. So we're looking for those areas and making sure that the nerve activation is firing so the placenta, or sorry, the uterus can push down and get baby out appropriately. If your nerves aren't firing to your uterus, it's not going to push baby out effectively, and those reflexes aren't going to fire as well as they should. So that's pregnancy. Postpartum, we're holding baby. I can't show you holding baby like this. So we're constantly crunched over, looking down at baby, whether you're bottle feeding or breastfeeding, you're looking down. Now, I call it caregiver's posture. So it's not just mom or the feeding parent, but it is all caregivers. That can include grandparents, aunts, friends, whatever it may be, whoever's caring for that child. They grow faster than our muscles can adapt to it. So along the mid spine, in between the shoulder blades, super important to get addressed postpartum, but also it helps with balancing hormones. So a lot of women at that 6-week checkup with their OB or their midwife, they're asking about mental health. And at that time, you have a flush of the hormones changing from pregnancy hormones to postpartum hormones. And it's important that you can help regulate those. So with chiropractic care, that's really where I'm focusing too. Because once you get a 6-week checkup, they're like, all right, you're good, go ahead and exercise. But there's so much more than that that needs to be addressed. So as far as pregnancy care, it's some of the aches, pains. And as far as the postpartum care, it's just getting back to what life looks like as far as you are as a caregiver, but also who you are as a person. I think that also helps with postpartum anxiety and depression and your transition as a mother. But that's both all caregivers. I think it's important for. Now, for pediatrics, for babies, infants, people are like, why would you take a baby to a chiropractor? It's not the same adjustment as an adult adjustment. There's no cracking, popping, twisting. I'm using light pressure. So with my fingers, it's like the same pressure that you would use to touch your eyelid without hurting your eye, or touching the ripeness of a tomato or an avocado, very light pressure. I'm making sure that their nervous system is balanced. They went through an athletic event as well to get out of your belly. So I see a lot of benefits with colic, ear infections, digestion, latch, bowel movements, the ability to regulate its system and reach milestones appropriately. We've had a little bit of a change of our milestones in the last year, and CDC has changed it a little bit. And I think it's important to reach those milestones in an appropriate timing and in order. And so with chiropractic care for infants, we can see that those milestones are being met and allowing for the brain to recognize that it's time for a new progression, right?
Wow, I love that. Let's touch on, because I know my pelvic floor PT friends would agree with the whole 6-week checkup being kind of the final like sign off, and really the only sign off after having a baby. And you know, being a physical therapist myself by background, like so much of your body changes during that pregnancy, during that delivery, and postpartum. So how soon can a mom come see you?
I say within that first week. So I like to see mom and baby within that first week. Sometimes I'll do a home visit if they really just can't get out of the house. But oftentimes I have people come to my office on their way home from the hospital or the birth center to get checked up. I think as soon as possible, that way we can get ahead of things before they become problems, because when things start setting in, and as you know, relaxin hormone changes, things are tightening up, and we want to make sure that they're in the appropriate place and functioning well. And so I like to see moms within that first week and baby. If you had a C-section, a lot of times people are nervous about laying on their belly, because I do have people lay on their belly during the whole pregnancy and postpartum. We can do everything on the back or seated. And so I just had a mom that had a cesarean, and her MD said, all right, maybe you should wait a little bit. We're definitely going to have a conversation that we can do things other ways. There's other techniques that can be used in order to make sure that she's getting the proper care that she needs. Absolutely. You get that 6-week checkup, and everybody's focused on baby. Everybody forgets about mom. You're focused mom during pregnancy, and then it's like baby, and you get lost. And it's important to address mom and make sure that she's getting quality care, because as you know, there's a lot of dysfunction that's happening. We're not utilizing our body the way that we should, and we oftentimes are put in postures and positionings just to get baby asleep or just to calm down baby. And then we're wrecking ourselves in order to achieve this goal. So I say as soon as possible. And how I practice chiropractic care, I believe that you have stress coming at you from all angles, either that be emotional stress, which of course none of us have. We're all doing just fine with emotional stress, and physical stress, whether that be you sitting at a desk or holding an infant or a car accident, or chemical stress. So that's the foods we put into our body, the chemicals we put on our skin, the air we're breathing, the water we're consuming. All of those have an effect on our nervous system, and we're constantly being inundated with that stress. So the way that I practice chiropractic is I believe that wellness care is important. And so less than once a month to me is too infrequent as far as getting checked up and getting evaluated, getting adjusted. And that's for baby and for mom. So that's how I practice and what I would recommend postpartum too.
Awesome. You kind of mentioned it a little bit about women even having the anxiety of coming in that soon. What can someone expect maybe from their first visit postpartum? Like if they were to walk in your office for their first visit postpartum, let's say.
Yeah. So I always want to do an examination. We're checking posture, range of motion, feel along the spine, checking for areas that aren't moving well that would lead me to suspect that there is an interference with the nervous system. And then we would start with the adjustment. So I would check to see sometimes it's uncomfortable to lay on your chest because your breasts are full of milk, right? Or the incision because of a cesarean. So I have a drop down table that will create space for the belly as you're healing. And then also I have a pillow that you can lay across at your breast so that you're not being squished down on that table. I check your sacrum, your pelvis for alignment. I release soft tissue. So I look at your glutes and do some trigger point work on there. I'll adjust through your mid spine, and then I'll adjust your neck if need be. I also check psoas. Psoas is oftentimes a trigger point that I'll release. And then we check baby, right? So it's very much a whole system, top to bottom look at everything, but we want to make sure that mom feels comfortable. I also have a conversation. How did you think the birth went? Right? Some people, even if it is a seamless birth, it can be traumatic either emotionally or it didn't go the way that they planned for it or expected it to go. So we have those conversations as well. How did you think the birth went? What do you feel about life after babies on the other side, right? How are things going with sleep? How are things going with your latch? Sometimes, as much as it is natural to breastfeed, it's not easy, right? And people have complications and they feel like they are failing in certain areas. So I want to look at, where do you feel like there's areas that aren't going well or not meeting your expectations, and having that conversation too. So I don't want it to just be just physical care, but also the emotional component too. I may be the only one that they can talk to about these issues, and I want to make sure that they feel comfortable expressing. Oftentimes I have pregnant women that they see a friend who was pregnant and they tell them about their experience, and maybe it's not a positive experience. And I always think, gosh, why would they tell a pregnant woman who's expecting a child their negative experience about birth? And I really believe that it's because they don't have anyone else to talk to about it, or they didn't talk to people about their birth story when they had it, right? Like, oh, now here's an opportunity for me to tell my birth story because it didn't go the way that I planned for it. And so I want to give that opportunity. So we definitely talk about, how did the birth go? How did you feel about it? And what are some of the things that you're concerned with now that baby's on the other side?
Wow. I didn't think about that till you said that, because really the first time you probably talk to a medical professional is your 6-week appointment, and they might be the one that birthed your baby. So you might not
Mm-hmm.
feel safe telling them that it wasn't the experience that you expected, or that, you know, it's because it's their practice. So I think having that third party, or having someone like you or a doula, or I know, there's a lot of postpartum doulas, somebody that you can speak to about that, because I think women hold on to that so much because there are so many expectations. You hear all these stories, whether good or bad, but you feel it should be a certain way. So being able to
Mm-hmm.
kind of share your story, or how your expectations were met or not met, I feel like is so important to mental health as a postpartum mom. That's amazing.
Absolutely.
So you mentioned a little thing about lactation, and I want you to just share a little bit about your journey, because this, let me just say, my story, this is near and dear to my heart, because both of my girls were born with tongue ties,
Mhm.
and had to have releases. And we came to see you, with Esme at least. And I went through, multiple lactation consultant appointments, occupational therapy, body work, and chiropractic work. So all of those kind of played a role in getting lactation to be successful for us. But like you said, it's natural, but it's not easy. Like we put in
Absolutely.
our work. So tell me about your journey, because I'm really excited for you on this.
Yeah, so I was able to breastfeed my son for 2 years. It had its challenges, and I didn't know all of the, you think, yeah, it should be easy. The baby should just latch on and it should work out well. And my first experience of breastfeeding, I had my doula there. She literally clamped down my breast and put my son to my boob. because I didn't know what I was doing. I really was clueless about breastfeeding. And then, of course, you have friends that may be formula feeding their children and giving 8-ounce bottles. And you're like, I'm only producing 2 ounces at the breast
Mhm.
pump. And it's very confusing as a mother to say, oh, I'm not producing enough. I went back to work 3 months postpartum, owning a business and starting a business from the ground up. And that adds another level of stress. So then your production comes down because your body's not able to produce in the way that you were once because you aren't with the baby the whole entire time. So to me, I thought it was very, very important to advocate for women and their desire to breastfeed. Oftentimes, because you have the lack of support, you may initiate breastfeeding, but to continue on with a duration of breastfeeding has decreased, especially in the US. The fear of potentially breastfeeding may even stop the initiation of breastfeeding. You may not even
Mm.
want to. So, because of this, and because I'm seeing so many infants with tongue tie, with lip ties, with feeding issues, I decided that I wanted to get a certification in lactation. And so I am currently pursuing a certification to get my IBCLC, which is the highest level of certification for lactation consultant, just so that one, in the beginning, you want to do everything for your child and get the best care. And like you said, you saw OT, you saw body work, you saw PT, you saw cranial, you did all of these things. And how many visits do you have to go to in order to receive that care and be able to get that function going? And so I wanted to be a little bit more of a not one-stop shop kind of place, but if I'm already doing body work on these individuals, I also want to be able to consult and help them go through this because they may not be having these discussions with anybody else, or they don't have the ability to go see a lactation consultant, or they may have this thought that I'm failing as a mother because I can't do something that is so natural, right? There's oftentimes things not only with the mom that needs to be addressed, but also with the infant that needs to be addressed. So I already do cranial work. I do nervous system work, balancing out that baby's body. There's 5 cranial nerves that are attached to feeding and latch that are important in the infant. So if they're having issues with that nervous system, it could impede on that, opening and closing the jaw. Turning their head. If you ever see a baby that's tilted off to one side or turning their head or prefer one breast, tells me that their top bone is rotated and they don't have the ability to turn the other head, almost like a crick in your neck, which could cause pain while they're feeding. And so I do palate work, make sure that everything's uniform in that area, that their suction is going well. So I thought, okay, well, if I am doing that, why don't I add in this additional component? Now, on the personal side of that is we want to have more children as a family. We want to grow our family, and chiropractic is a physical job. So I want to be able to still care for the families in my community, but I may not be able to initially get back into chiropractic care right away after having baby 2 or 3. So I thought if I can transition into more of the lactation consulting side of it and still do, infant adjusting, it's very minimal stress on my body. I can still help the community. It's a thought in my mind that these women need help, and if I'm here, I want to be able to help them and serve them.
I love that. I absolutely love that. I again, I saw many different specialists and I was driving all over. Now for my first, not so much because I didn't really know the impact that it would have. And I did go to lactation, but I think that was the only specialty I did see for Arlo. But for Esme, yeah, I was seeing like 4 or 5 different professionals and I was driving all over
Oh yeah.
town. And as a new mom now, it was doable for me because my second baby was I recovered a lot faster after baby 2 than baby 1. But for some moms, that is very, very difficult. And I just think the education piece that you bring to the table is huge. I did not know anything about a tongue tie when I had Arlo. And I remember, again, didn't know anything. I was in the hospital. And after like the first or second latch, I was just like, I just feel like she's like gumming me. Like, I just felt like she was
Mm-hmm.
biting down on me. And I was like, is that normal? Again, I've never
You
breastfed
don't know.
before. I know nothing about this. And I just so happened to say it when you have like the one appointment with the lactation consultant before you leave the hospital. And that one happened to be well-versed in tongue ties. And she said, I'm not allowed to tell you this, but I'm going to write this down, because apparently there's like a silencing laws in hospitals where they can't refer out of their network, which is really sad to say.
Mhm.
Kind of, I think I liken it to maybe your experience where you just felt like you weren't serving the population that you wanted to serve. Um, but here it's because they're kind of like bound, like it's a gag policy
Yeah.
basically. And she wrote down the name of a practitioner that was specialized in tongue tie revisions and everything, and so I could get a full assessment. And it opened up my eyes to something that I had no idea about. And I oftentimes now think, how many women go undiagnosed, or how many babies go undiagnosed with this, and breastfeeding fails because they can't transfer milk, and there's so many issues that go along with tongue ties post, bottle feeding stage, as they get older, so again, that's kind of going off on a tangent, but I love that you're kind of combining this, because having a place where you can get multiple services offered in one spot is going to be priceless to a lot of women. So that is awesome. When do you think
Yeah.
you'll be done with your certification?
So they offer the testing twice a year, and so I will test in September of 2023. So they offer it in March and September. So I have to wait September 2023. But once that comes in, and of course I'm still acquiring the knowledge. So even if I don't test out, I still get to, put this knowledge out on the families that I see. And,
Yeah.
I get little gems here and there. I'm like, hey, did you hear about this? Do you know about this? This is something that, and I still refer out to the IBCLCs in the community. I
Mm-hmm,
still
mm-hmm,
want people to reach those resources as well. But some people don't have that option, right? So I want to
mm-hmm.
be able to provide that, because a lot of providers don't, like your pediatrician may not know what one looks like, or may know how to assess for one. Your lactation consultant, not all of them are well versed in tongue tie, lip tie, like you said. And also, those that are doing revisions don't tell people that doing exercises and the post care is really important, so that you don't get reattachment. And I didn't see this population before I started my own office. And now, since seeing more and more of these babies and seeing more of these families, I see how important and beneficial it is. And so when they come to me and they're like, oh, they didn't give me any exercises, or they didn't give me any post care, I think, okay, we need to make sure that you get into the right hands and that you're getting the right care for your child, so that this isn't a waste. Because, of course, it's either a cut or a laser that's being done for this. And so, you think about what the baby is experiencing, and you don't love that idea.
Mm-mm.
So you don't want to go through that for nothing for it to reattach. Now, there can be functional tongue ties and lip ties, so I don't think all of them need to be revised. But if there is a tongue tie, lip tie, that means that there's tension in the body. And so I think body work is super important, whether that be cranial sacral therapy, chiropractic, PT, OT. I think these are very beneficial regardless of revision, before and after. So that's one little tidbit that I would leave with
I
some of the
lif
families.
that. Like, what does it mean to be living in your legacy?
So I think one thing that I've kind of talked to my families, my moms about, there is if anybody watches TikTok, there's this mom on TikTok that talked about flamingos lose their pink coloring when they become parents. And so they're giving everything, they're pouring everything out to their children. And then eventually they get their pink coloring back. And so she has this, and it really makes me emotional thinking about it, but she has this shirt that she's come out with that says, let's get our pink back. And I think it's huge as somebody that became a mother. And I love what I get to do with my son and who I've become as a mother. I feel like there's a time that you can lose yourself and your sense of self. And I know I talked about it before, of I really love what I get to do. I love being a pediatric prenatal chiropractor and seeing the population that I get to see. It really brings, a spirit, uplifts my spirit to see that population. I love going home and seeing my son, but at the same time, it's exhausting to do everything. Mental load. I don't think people talk about it enough, that mothers especially, but fathers and parents can also experience that their level of mental load can be so high that you can be very, very forgetful or stressed out. And, the touch of your child could bother you because of how, just overstretched you are. And so I think it's important that women and families and parents see that, okay, yeah, we should get our pink back. What is something that makes you passionate and brings life out? Right now, for me, it's my practice in being able to care for other families. But I can see that changing as things progress, and that as I walk through motherhood, I'm 2.5 years into being a mother, but I think that it's important to develop those things that also bring you passion and excitement that isn't necessarily work related or family related. Um, yeah.
I love that. I think I was on this journey, and this is kind of really what spurred this podcast was, you're allowed to change. And I think so much of us have that baby and feel like they need to be the same person they were prior to the baby. And your life is going to look different. It's going to look different. And it's being okay with letting go of things that don't serve you anymore and pursuing things that you're maybe passionate about in this new realm. And it could be the same things. It might be the same things, but I think a lot of it is just letting go of those things and moving forward, and then and really carving out that time for you. Our youngest, or your son and my youngest, is about the same age. We were not far off from each other with that. And so I really feel like we're kind of at a point now where they're talking, they're moving, they're a little more independent. And so we can kind of focus a little bit more on ourselves and our passions. And I think, it takes a lot of internal work. I have been doing a lot of therapy, and I feel like kind of rediscovering myself and learning my needs and wants again, because it totally changes. And it's something that I really feel like people do need to spend the time, maybe the money to talk to somebody about it and really find out like why things are working, why things are not working. What is it about me that makes me feel this way, and then really pursuing, like I said, what kind of brings a passion into your life, what lights you up. So I love that.
Yeah, absolutely. I think that's huge.
Cool. Thank you for showing up today and being authentically you. The most costly thing you can do is to be real, and I appreciate you.
Oh, thank you so much. I
I
appreciate
love
you so
talking
much.
with you, Allie. I'm so glad we got to do this. I'm probably going to have you back on, so be ready.
Yes, absolutely. Thank you so much for inviting me.
All right. Talk to you soon.
Bye.